Hey, class, how's it going today? So, we're going to talk about immunity today. And this is a topic that I think is so common to quite a few people because we think about our immunity. This comes into contact and play with most people when we think about being sick, right? And staying healthy, not having sickness, decreasing our absenteeism at work and at play, and all these different things, being able to be healthy and reduce our time being sick. But our immune system is truly amazing, and primarily because our immune system is essentially a checks and balances and surveillance system, right? This system, immunity is just resistance to disease, right? And we live in a world where there's plenty of opportunities to contract diseases, have autoimmune diseases, and have hypokinetic diseases for lack of activity diseases, cardiovascular disease, metabolic disease, things of that nature. Literally, disease is everywhere. Bacteria are everywhere. And so this system is really focused on how do we prevent disease or have resistance to disease, and what happens when we get things like the common cold. How do we fight these diseases that come in? How does our system look at that and go, hey, we have to do something about this to get you back to homeostasis, which is always the goal of our body, is to get back to balance or homeostasis here. So our immune system is essentially a widely distributed population of cells, diverse chemicals, physical barriers, and physiological responses. Surveillance, response, recovery is really the focus. Surveillance, response, recovery. And then, as part of this process, we have pathogens, which are agents capable of reproducing or producing disease, including viruses, bacteria, fungi, other microbes. Another aspect to this, and as we'll get into our digestive system when we talk about that, is our microbiome and our gut flora, which play a huge role in terms of our immunity. So let's think about it this way. For most of you, thinking about flu season and things of that nature, or dealing with sickness, this is something is pretty common, right? Everyone's had a cold. Now, how many colds do you get throughout the year? Some of you may say very little. Some of you maybe feel are sick all the time. I have clients regularly who have children or themselves are constantly sick. And that is a large, now there's lots of issues that relate to that. Obviously, exercise helps tremendously with bolstering immune system. Now, that can be a little different if you're exercising too hard, too long. You have transient immunosuppression, which over time lowers your immunity. But generally, moderate exercise or even high intensity exercise on a short level will help to bolster your immune system. Nutrition is a gigantic portion of bolstering immunity, because immunity is related to your gut flora and your microbiome. Give you a good example here. Now, I want to give a disclaimer here, big disclaimer. I am by no way promoting that you should change your dietary or nutritional approach to what I'm doing. I'm just telling you a personal story for me. But I can also add in quite a bit of research-based information for this. But again, please don't take this as that I am promoting for you to do this. For the good portion of my life, I was someone who ate pretty much anything, was an athlete, and I didn't really have any nutritional wisdom. And for the longest time, I ate a huge amount of meat. And I did that up until basically a couple years ago. And I decided that I wanted to try a vegetarian-based approach. Now, before I was sick, I would say 3 times a year maybe, and they were always bad colds, things of that nature. But as soon as I had some more nutritional wisdom for myself, and I moved to a vegetarian-based practice, which I've done for 2 years now, I just haven't been sick. And one of that is the reason that almost an overwhelming majority of your immunity comes from your gut flora, which comes from your digestive tract. You'll watch a presentation about that. But one of the things we know is that food, especially inflammatory foods, a lot of red meat creates a huge amount of inflammation in our gut biome and affects our immune system dramatically. Once I changed to a vegetarian-based approach, I actually saw a huge increase in betterment in my gut flora, My microbiome improved dramatically, and I've rarely had any issues or instances of having sickness. I haven't even come close with that, and I felt the change with that. Again, I'm not recommending for you. You need to do whatever works for you in your life. Everyone has different bio variability, but I can say that eating more fibrous-based nutritional products, eating more vegetables, having a more forward plant-based approach versus a very meat-centric approach, especially red meat. We know clinically, we know research-wise that this creates a much better gut biome, gut flora, which improves your immunity. No one wants to be sick, right? No one's going to sit here and say, oh, I want to be sick. No one wants to be sick. That's ridiculous. So, again, this was an approach that I had known for a long time, and I had consulted with physicians, all the people, colleagues of my business, nutritionists, focused with different clients who are cardiologists. And maybe you didn't know that the American Cardiology Association actually promotes a very vegetable-forward-based nutritional wisdom. Again, not saying you need to do this, you do what you want to do, but just a story of showing, at least for me, how nutritional wisdom has been tremendously positive in terms of immunity, and certainly immunity in digestive tract, my immune system. So when we're looking at the immune system, we have two intrinsic immune systems. One was we have an innate and adaptive. The innate system is a non-specific defense system, and the adaptive system is a specific defense system. So within the innate system, you have a first line of defense and a second line of defense. That first line of defense is your skin, mucous membranes. Your skin, your largest organ, is a barrier, right? We know a lot from your skin. The coloration of your skin in terms of redness, non-redness, whether something has more life in it, more purple, less purple, things of that nature. Coloration actually tells a big story of what's happening inside of our body. We think about when learning about the lymphatic system, especially our neck where there's lots of lymph nodes and swelling. You can see that in your skin. All right, that first line of defense is your skin, which often starts to tell us how well things are working inside in your immune system. So skin health is incredibly important and predictive of immunity. Our second line of defense is our protections against pathogens that break the skin and the mucous membrane. So this, you're looking at macrophages, neutrophils, natural killer cells, fever, and inflammation. Fever is actually a really good sign of fighting something that's going on. Inflammation also is telling us a lot. And fun fact, maybe not a fun fact, but inflammation, we're starting to get a voluminous amount of information that inflammation may be one of the primary characteristics of biological aging. Right now, it's our best guess at what actually causes advanced aging is inflammation. And if you're having lots of inflammation in your gut biome and your immune system, you're actually, right now, all indications are that this is a tremendous marker for advancing age. So I started taking really serious care of my gut biome, my immunity a couple years ago, and it's paid off. It's been actually truly amazing. Again, there's different approaches for different people. But I think taking an approach that works to improve your immunity, incredibly important to improve both your first line of defense, your second line of defense. Nutritional wisdom helps in that first non-specific defense system. Now, in the adaptive system, this will be considered your third line of defense. All right, so adaptive immunity are mechanisms such as lymphocytes and antibodies that defeat a specific pathogen and then leave the body, and this is the big part of it, it leaves a memory of it. So essentially think about it as leaving like a tracking signal or a beacon, and it says, hey, you came in the door one time, and when you leave, I'm going to remember that you came here before. So that adaptive immunity allows you to basically say if pathogen comes in next time, you go, I know what you are, I know how to fight this. This is what the problem is when you have novel viruses that enter the body, right? So when a novel virus that the body has never been exposed to enters the bodily system, there is no adaptive defense system at that point. The body doesn't know what it does, and so the body can't fight it effectively. That's why vaccinations are developed to help to become an adaptive defense system. Without that, the body doesn't recognize it. So anytime there's a novel virus, something that your body does not know what it is, it doesn't leave a memory of it, the body cannot effectively fight it, and therefore you end up having serious hospitalization or even death from that. So that's why novel viruses are so difficult for the human body, because there's no trace of it. It's not like when you have been exposed to something before, you build up antibodies for it and you build up immunity so that next time it comes, body identifies it, knows to release natural killer T cells, white blood cells run to the area and then help to extinguish this. Without that, you're basically defenseless for that. So our innate immunity are generally also defenses we are born with, all right, protect us from a broad spectrum of disease agents, right? So it has what would be called a local effect. It defends at the point of invasion. There's some exceptions here. When it's nonspecific, defenses are against a broad spectrum of disease agents rather than one particular pathogen. So when you lack memory, you do not remember the exposure to a specific pathogen for that. One issue with autoimmune diseases and immunity is that when the body is forming, when you are forming in the womb, there is an inventory check system. This is me, this is me, that is you, this is me, this is me. And when something is not you, then all of a sudden the body attacks it and goes, or actually, let me back up. When that inventory is taken and the body has an autoimmune disease, it goes, normally it would say, this is us, but it goes, this is not us, and then it attacks it. Then you have the autoimmune diseases. So it's important to remember that innate defenses versus adaptive defenses are very different. And one of the important aspects of adaptive defense is that this tracer, this leaving a memory, which helps you fight fights infection over time or diseases over time for that. So remember, that first line of defense is skin. And so taking care of your skin has to be a big portion of you protecting yourself, immunity. This goes back to exercise too. When you're exercising, you have better circulation, which also creates better skin health as well, better arterial health, endothelial lining of the cells. Again, our system is a complex, holistic system. Our skin gives us one of the first signs of something going on inside. So it's really important that we have great skin health is important as well for that. Okay, so in your slides, you'll be able to connect on things that are much further down in the system to go a little bit deeper. I like to provide more of a high-level information for this just to help you understand the system a little bit better here for that. So again, let's talk about inflammation again, because as I had mentioned to you about inflammation and aging, that's not something in your lecture notes or in your slides. But again, all of this is a holistic system to learn about that. So inflammation, understanding that's a second line, it's an innate second line, and without inflammation, we wouldn't know what's going on. It's like pain is an indicator of something going on. If you never felt pain, you actually, not feeling pain is not good because it's an indicator. It gives us direction that something's going on. It's a feedback mechanism, right? And inflammation does that. It tells us. So for example, I've been training for a marathon. And in this running, I have runner's knee a little bit. I have patellofemoral syndrome, so irritation of my patellar tendon. And that inflammation, I feel it, I can see it. It's a local defensive response to a tissue injury, including trauma and infection. So what does inflammation do? It limits the spread of pathogens, and it tries to destroy them. It also tries to remove debris from damaged tissue and start the process of initiating tissue repair. And so there's 4 cardinal signs. Remember this will be on your exam. Redness, swelling, heat, and pain. 4 cardinal signs. Redness, again, coloration. The skin tells us something, right? Swelling tells us something. Inflammation, trying to limit the problem. Heat, feeling temperature. And then again, pain. Pain is good. If you don't have pain, you're in big trouble. Pain tells us and directs us for what we should be doing for that. So a very important aspect to know. And this also involves cytokines, which are small proteins that function in chemical communication between cells. So they alter the physiology of the receiving cell, and this includes things like interleukins, chemotactic factors, and other things with that. So again, you can look a little bit further into this as we go down to it, but it's important to remember that tissue, that understanding that this innate system, inflammation is a huge part of it. Okay, so when we're having inflammation and we're trying to clean up this system, we have tissue cleanup and repair. So this usually involves monocytes, right? So which arrive in basically 8 to 12 hours. These become macrophages. They engulf and destroy the bacteria in the system. They damage the host cells and dead and dying neutrophils. So we're starting the process of trying to heal, right? Edema happens, right? That swelling compresses the veins. This contributes to tissue cleanup, so we don't have other stuff coming in the system. Think about you're building almost kind of this dome to keep you from having things coming in to continue the process of damage. So that swelling compresses the veins, reduces the venous drainage, forces open lymphatic capillaries, promoting lymphatic drainage. We need that drainage. Again, I'm actually a big proponent of moving through injury and moving through sickness. Now, there are limits to this. You can do too much and hurt yourself and exacerbate the issue. But moving through sickness, moving through inflammation related to injury and things of that nature are very important aspects to healing, because it increases lymph drainage, which we know only happens through the musculoskeletal system pump. Gets out toxins in the system, along with things like your kidneys, things of that nature. But then also, once you have in this system as well, is you have an accumulation of things like pus, like yellow accumulation. I'm sure many of you have seen this before. And this is like accumulation of dead neutrophils, bacteria, cellular debris, and tissue fluid. That's what pus is for that. So our adaptive immunity, kind of generally looking at in this third line defense, it has a systematic effect. So that means just acts throughout the body. Okay, it's kind of a whole body holistic defense system. It exhibits some specificity, generates protection and immunity to specific pathogens on an individual basis. Again, the big part of this is that it has memory, right? It remembers when you were sick before and you had certain pathogens in your body. It goes, I remember you, and I'm going to take you out. So when you're re-exposed to the same pathogen, the body reacts very quickly, and also this creates no noticeable illness. So this, if you didn't have adaptive immunity, you would actually be sick all the time, because you would essentially just be experiencing novel viruses and bacteria so much you can never function feeling normal. So that adaptive immunity is incredibly important. Again, strengthened through exercise and movement. Really important to push that as well. So we think about this two overlapping arms of adaptive immunity. So we have cellular immunity and we have humoral immunity, right? So the cellular immunity includes T cells, right? These are lymphocytes that directly attack a foreign cell invader or diseased host cells. What happens, these T cells release, it sees the pathogen, it goes, I'm going to destroy you, before this even gets to the rest of our body and we start feeling poorly. And by the way, when you are sick, that's actually good that there's a response of inflammation, fever, and all those things, because it's your body actively fighting infection or disease, those things like that. So what we see happening is there's all this rise in antibodies that happens inside the body, and these start to help to create the change here in the adaptive immunity. So think about it. The cellular immunity is T cells, where humoral immunity is B cells. These are mediated by antibodies. They don't directly destroy the pathogen, but they tag it for destruction, right? They basically, again, put a tracker on it. It's like, I'm tagging you to make sure we know what you are. It's an identification immunity. B cells. T cells are the attackers. B cells are the trackers. Attackers, trackers. Remember it that way as well. And then we also have antigens, which antigen means antibody generating. All right. So these characteristics enable the body to distinguish the self from the non-self. Okay. So again, we are made up of so much in our bodies, and a lot of what's in our body is an identification, an inventory of what is us and what isn't us. What is not identified as us gets attacked and destroyed. Remember, it gets tagged by B cells, destroyed by T cells for that. So antigens are very important for actually being able to properly labeling what is us and what is not us. Complete antigens trigger an immune response and react with immune system cells. So, for example, a foreign protein, polysaccharides, lipids, nucleic acids, complete antigens. Then you have haptens. So these are incomplete antigens. They're small molecules that are not immunogenic by themselves. They're not, but when attached to a body of proteins for that. All right. So that goes a bit more into that system there. So we're going to cover a bit more here as we go in here. So let's keep moving down. I have some of the slides here, but I just kind of like to freelance a little bit as well because I just enjoy talking about this stuff and not making it so much that you're looking at the slides for that there. I want you to hit the highlights as going up here as well. All right. So as we start looking back at cellular memory a little bit more, immune memory follows the primary response in cellular immunity. So memory cells are long-lived. They're more numerous than native T cells, and it takes fewer steps to be activated. So they respond more rapidly. It's called the T cell recall response. Again, just adding to what we were talking about before, is that if there was no large T cell response, you would constantly be attacked by foreign pathogen invaders, and you would really have no way of knowing how to deal with it. So again, think about this. Remember what I said in the beginning. How you deal with your immunity starts with so much of it is exercise and nutrition, especially nutritional wisdom. Contributes dramatically towards the health of your immune system and the response of your immune system. So many people don't think about their immune system related to their health and well-being in terms of exercise participation, and they certainly don't think about their gut flora, their microbiome, and how this area of your body is primarily responsible for your immune system. So what you eat, the quality of what you eat, the wisdom of what you eat directs relatedly to your level of sickness and your ability to fight sickness. No one wants to be sick all the time, but a lot of people who are sick all the time is due to lack of exercise, and a huge part of it is due to nutritional wisdom and also stress. Stress and inflammation in the body relates to that as well. So all is to say again that having healthy lifestyle practices helps to improve your immune system, which also helps to improve cellular memory as well with this. It's actually quite remarkable that we basically have the answers to our well-being. It's a matter of us actually taking the time, being intentional, setting up systems to be able to properly be consistent to have better immune health and overall health for that as well. So really, really important, very important for that. All right, so let's look at a few things here. So again, we talked a little bit about immune system, autoimmune diseases, right? These are failures of self-tolerance. The immune system and autoimmune diseases just doesn't tag that this is us, right? It doesn't know that this is me, so I'm not going to attack it. I'm not going to have an attack or a tagging mentality on this. So it basically produces autoantibodies. These autoantibodies attack the body's own tissues. So this is very common in things such as MS or rheumatoid arthritis, type 1 diabetes, or juvenile onset diabetes, where this is difficult because the body has essentially said, well, these parts that are supposed to be me are not me, so I'm going to continuously attack these diseases for that. So essentially also what happens in immunodeficiency diseases is that they're characterized by an immune system that fails to react in a more vigorous nature, right? So there's a vulnerability to opportunistic infection. And this often we'll see when people are immunocompromised, right? There's not a big enough immune system reaction to create a healthy system. About 4 years ago, my dad got a heart transplant. And heart transplants are literally amazing. But one of the things is that when you have a heart transplant, it severely compromises your immune system. Your body is trying to reject the heart that it receives because the body goes, this isn't ours. This is not ours. So you have to take medication that helps the body to not reject. Again, a lot of sickness and fighting sickness is based off of this inventory system. What is the self? What is not the self? And when the body doesn't know that this is part of the self, the body attacks itself for that. Again, some of this just happens in utero, and sometimes the system is not fully formed in a way that allows the body to have great immunity for that. But often we know in our world we're living in that a lot of our immune system deficiency is through lifestyle choices, and we can do much better in order to help to decrease that. So in summary with this is immunity is really very much focused on these high-level points, right? What's innate immunity versus what is adaptive immunity? What is the first, second, third line defense? Then understanding how the body responds to it, right? Looking at T cells versus B cells, attack destruction cells, T cells, and the B cells, a tagging system. And then what happens when that system doesn't work well, right? We have autoimmune diseases here, or immunodeficiency diseases, again, which also so much of this is related to inflammation, right? Inflammation is good in one sense in that it helps to protect the areas and things that are happening, walls off more pathogens coming in, starts the process of tissue repair. However, chronic inflammation over time, we know contributes greatly to destruction of bodily systems. And we have very good data. The data are pretty clear at this point that prolonged inflammation in all parts of the body contributes to advanced aging. And prolonged inflammation, what is the treatment for that? Less stress in your life, better nutritional wisdom, better sleeping, and certainly more exercise, regular exercise that is moderate in nature, vigorous, not too much, will help to buffer and bolster these systems. Again, exercise is always going to be a part of this because there's literally no better efficacious thing you can do to affect all systems of the body than through exercise. And immunity is no different than that. So it's really important that this is added into it. But this is a system too, the immune system, heavily affected by nutritional wisdom. And obviously you need to find what works best for you. But I would encourage you tremendously to take an inventory of your nutritional wisdom and do this early in life, because what you're eating, the quality of what you're eating, where it comes from, the type of food you're eating contributes tremendously towards the well-being of your immunity. All I can say is evaluate that for yourself and do what works best for you. All right, everyone. Thank you so much for your time. I love doing these presentations. I think they provide just a different look at the different topics that we're going over. Have a great rest of your day, and until next time.